Welcome to This Explainer. Today we're diving into what's basically a medical detective story. You know, the human body is incredibly communicative, but, well, it doesn't always speak up in the ways we might expect. Often it relies on subtle clues, tiny biological whispers that we really need to decipher. Today we're going to decode one of the most critical health puzzles out there. We'll be looking closely at how to listen to our bodies, understand the underlying biology, and recognize the quiet signals of colorectal cancer before they ever have the chance to turn into a war. It's a pretty striking question, isn't it? Think about it. What if one of the most important warnings your body could possibly give you is something you literally see every single day but almost never talk about? I'm talking about a change in bowel habits, or maybe blood in your stool, unexplained fatigue, just losing weight without even trying. It is so easy to brush these things off. We tell ourselves, oh, it's just stress, or maybe it's hemorrhoids, a sensitive stomach, or just the normal wear and tear of getting older. But sometimes, these easily dismissed signals are pointing to something much more serious happening quietly inside of us. To really understand why paying attention to this matters so much, we have to look at the global scale of the disease. The World Health Organization estimates there were 1.9 million new cases worldwide in just 2022. That makes it the world's third most common cancer, and actually the second leading cause of cancer death globally. But here's the truly frightening part about those statistics. In its early stages, this disease can cause very few symptoms, or honestly, no symptoms at all. Okay, let's dive into this and look at the actual biology. What exactly is colorectal cancer? Well, picture your large intestine, which includes the colon and the rectum. It functions kind of like the walls of a long biological tunnel. Its main job is absorbing water and processing whatever's left over before it leaves your body. Colorectal cancer usually kicks off as a polyp. Basically, that's just a small growth of abnormal cells right there on the lining of that tunnel. Now, I want to be super clear here. Most polyps never actually become cancer, but certain types, if they're left unchecked over time, can gradually develop into it. Let's take a look at how this actually builds. Walking through this chronological progression proves one of the absolute most empowering facts about the disease. Cancer takes time to develop. It doesn't happen overnight. We go from a normal intestinal lining to some abnormal cell growth, then to a precancerous polyp, and finally to colorectal cancer. Early on, that tiny abnormal growth might not cause any obvious issues whatsoever. But as it develops, it can bleed, it can physically interfere with the passage of stool, and eventually invade the surrounding tissue. This progression right here is exactly why catching it early is so incredibly valuable. You don't necessarily have to feel seriously ill for something serious to be brewing. Section 1. Anatomy of a Whisper. Let's explore the 5 crucial warning signs. Now, before we go any further, I want to reassure you, having one of these symptoms does absolutely not mean you automatically have cancer. Many of these exact same symptoms can be caused by simple infections, changes in your diet, or inflammatory bowel disease. Our goal here is just to help you recognize when a change needs a doctor's eyes. So, warning sign number 1 is a persistent change in bowel habits. That could mean new or ongoing constipation, diarrhea, or a noticeable shift in how often you're using the bathroom. Also, keep an eye out for stools becoming narrower than usual. Let's connect that directly back to the biology. Remember that tunnel we talked about? If a tumor is growing inside the colon, it actually physically narrows the passage for stool, which changes its shape as it exits. A quick, temporary change isn't an automatic red flag, but when a change persists or keeps coming back, that's your biology telling you it's time to talk to a healthcare professional. This brings us to a very common assumption about our second warning sign, blood in the stool. A lot of folks assume that blood just automatically means hemorrhoids. And look, sometimes it does. But the medical reality is that persistent rectal bleeding has a ton of possible causes, and colorectal cancer is one of them. So the absolute most important point here is this. Please do not try to diagnose the cause yourself. Whether the blood is bright red or the stool becomes very dark and tar-like, which just depends on where the bleeding is actually happening inside you, any unexplained or persistent bleeding 100% deserves a proper medical evaluation. Moving right along to warning signs 3 and 4, persistent abdominal discomfort and unexplained weight loss. Discomfort can show up as cramps, pain, bloating, or honestly just a general nagging feeling that something isn't quite right in your abdomen. Now, obviously, these symptoms are extremely common and usually have causes completely unrelated to cancer. For our medical detective work, the magic word here is persistent. This is especially true if that abdominal pain or unintentional weight loss shows up right alongside those changes in bowel habits or bleeding we just discussed. Bottom line, don't wait for dramatic, sudden weight loss before you decide to take it seriously. Number 5 is persistent fatigue and unexplained weakness. This one is just so incredibly easy to brush off, right? We say, oh, I'm just getting older, or work is stressing me out, or I just didn't sleep well. But let's look at the hidden biology for a second. If you have a bleeding polyp in your colon, it's causing chronic, completely unseen blood loss over time. That slow drip of blood loss eventually leads to iron deficiency anemia, which is exactly why you're left feeling so unusually tired or weak. In fact, the WHO specifically lists persistent fatigue and low iron levels among the key symptoms for this disease. It's a perfect reminder that sometimes your body's first real clue isn't a sharp pain at all. It's a slow, quiet drop in your energy levels. Moving on to section 2, the risk equation. Let's look at who is at greater risk. Now, what's really interesting about this slide is how it breaks things down. Understanding risk is all about balancing reality without, inducing a panic attack. Knowing these factors helps you make informed choices about your own health timeline. On the left side, we have uncontrollable factors. Age is a big one. Risk goes up pretty substantially after 50, though we are definitely seeing it in younger adults too. We also have family history, genetics, and conditions like Crohn's disease or ulcerative colitis. But then look at the controllable factors column: smoking, heavy alcohol use, physical inactivity, and diets packed with processed and red meats. These are areas where you have real agency. And remember, risk factors are not destiny. Having a risk factor doesn't mean you will absolutely develop cancer, just like having 0 obvious risk factors doesn't give you total immunity.
Which leads us perfectly into section 3, the screening secret, finding problems before they even start. Because risk isn't destiny, we actually have a remarkably powerful tool at our disposal here. Think about it. Why wait for symptoms to show up when some colorectal cancers can be spotted long before they cause any problems? Screening isn't a scary medical procedure. It is the ultimate preventative tool. It actually identifies those precancerous polyps we talked about earlier, giving doctors the chance to literally remove them before they ever turn into cancer. Here in the US, major expert groups generally say that adults at average risk should start regular screening right at age 45. But if you've got a family history, inherited conditions, or inflammatory bowel disease, you might need to start earlier or get screened more often. The big takeaway here isn't to just memorize the number 45. It's to have a real conversation with your doctor about a personalized screening schedule that fits your specific health history.
Now, if you do go in for an evaluation or if your doctor suspects something, the pathway is actually very straightforward. It usually starts simply with a medical history and a physical exam. From there, it moves to some blood tests and imaging, and then a colonoscopy or a similar colon exam, followed by a biopsy if they need a closer look. It's just a step-by-step process to gather information. And here is absolutely the most crucial part to remember. If cancer is confirmed, treatments, whether we're talking surgery, chemotherapy, radiation, or targeted therapies, are generally so much more likely to be successful when the cancer is found early. Screening isn't about living in fear, it's about giving doctors the best possible opportunity to treat you effectively. And our final section, proactive empowerment, taking control of your health. Let's wrap up by focusing on evidence-based prevention and the actionable everyday steps you can literally start implementing today. Look, you can't change your age or your genetics, but you absolutely can change your daily habits. Staying physically active, maintaining a healthy weight, avoiding tobacco, cutting back on the alcohol, and fueling your body with plenty of fruits and vegetables. All of these are proven steps that actively reduce your overall risk. But above all else, never, ever ignore persistent changes in your body. Please don't fall down an internet rabbit hole trying to diagnose yourself if you notice ongoing discomfort, weird bathroom habits, or unusual fatigue. Speak with a qualified professional. I want to leave you with this final thought. Your body doesn't always shout when something is wrong. Sometimes it whispers. Becoming a student of your own health means learning how to recognize those whispers early. It means taking proactive control through your lifestyle choices and keeping up with those timely screenings so you ensure that you hear those quiet clues while you still have plenty of time to change the story. So ask yourself, if your body started whispering today, would you be listening closely enough to hear it?